Afternoon, everybody. I think we are officially live on Facebook, and I wanted to address a few things. I'll wait till some people get on here for a second. Get a sip of water because I get a little long-winded. For those of you guys that don't know me, most of you are probably following me or at least know who I am. My name is Tomo Marjanovic. I'm the owner of Aspire Rejuvenation Clinic and Aspire Rejuvenation Nutraceuticals, which is a supplement company that is tied and linked to my clinic. I am first and foremost not a doctor. I'm a business owner. I am not a doctor. I am not here to give you medical advice. However, I am going to go over some medical things I think you should consider, like hormone health, like blood work, like maintaining healthy vitamin levels. I do have some training in the medical industry, but again, I am not a doctor. I'm not a nurse practitioner. I am simply a business owner with a passion for hormones. I have been trained abroad in Dubai through A4M and also through WorldLink Medical. I believe I was the first non-medical person to complete all 4 parts of the advanced BHRT course over through WorldLink Medical. So that's kind of a cool thing. So without further ado, let's start talking about some hormones. Importance of hormone health, therapeutic HRT, what it is, what it isn't. One of the things that I keep seeing a lot of negativity on, especially YouTube and stuff like that, and we're on Facebook right now. I will probably post this video on YouTube, maybe on Instagram as well. This is therapeutic HRT, HRT standing for hormone replacement therapy. This is not taking steroids. This is not abusing steroids. This is not abusing drugs. These are actual medically driven, science-driven therapies, okay? And they are prescribed by a doctor. We're not talking about, what people think hormones are. As soon as you say the word testosterone to somebody, people automatically say, oh, bodybuilding, taking steroids, or you start thinking about baseball, taking steroids, the growth hormone and testosterone craze that swept baseball. We all know that was going on and is still going on to this day. Regardless of that, this is not what we're talking about. There is plenty of abuse going on out there with hormones. We all know it. We all see it. You guys all see that gym bro out there taking too much crap and, very, very unhealthy way to take hormones, and it is not an optimal way to have your hormones. We are not talking about optimizing hormones there. That is complete abuse. It is drug abuse. There is no other way to say it. I was an ex-bodybuilder. I am friends with a lot of bodybuilders. There's a very big difference between a therapeutic testosterone dose and a very high abuse of testosterone. The crazy thing is that, a lot of these guys that you see out there, a lot of these guys that are pro bodybuilders, they are not necessarily abusing to a point that you think they are. I know several of them personally, and a lot of you guys can try to call me out on this. There are a lot of guys out there that are doing it in a very healthy way. A lot of them come to our clinic. So therapeutic HRT, guys, we are not talking about just testosterone. Ladies, estradiol, progesterone, men and women for thyroid hormones. Okay, we are talking about optimizing everything. All right, all of your hormones, when you start getting older, will naturally start to decline. Is that a natural process? Absolutely. Is it supposed to decline eventually? Yes, absolutely. Do you have to live like that? Do you have to live in that steady state of decline? No, you don't. You actually can thrive into your older age, and you can basically trick your body into behaving and reacting like your younger self. That's kind of what we do. That is what we do here at Aspire Rejuvenation. We make men and women feel like their younger selves, okay? We do this. It's not complicated, but it is very specific, okay? So if you're a patient, if you want to become a patient, you go on the website, you fill out our contact form, our staff contacts you. Let's say you have no blood work. You contact us, you get blood work, okay? So we get your blood work back, your results come back to us. We schedule you for a consultation with one of our doctors or nurse practitioners. At that point, you have your free initial consultation. That initial consultation, they'll go over all of your blood work, and they will see if you have any hormone deficiencies. They will see if you have anything that's kind of out of whack. And we have a very comprehensive panel. Now, again, there are levels. So our initial comprehensive blood panel, we are at $150, okay? So $150, you get this comprehensive blood panel. Now we have higher and more comprehensive blood panels that are available. They go into the $250, $225, $300 range, and they test absolutely everything. Is that necessary to get your foot in the door? Not usually, okay? Those tests are usually reserved for people that we need to do a little more of a deep dive into what's going on with them, because those obvious hormone markers aren't telling us enough. Most of the time, everybody is able to really get a good picture of what's going on with their body on the inside when we do the initial blood test. So your full thyroid panel gets tested, your estradiol, your progesterone, your testosterone, both free and total, guys, okay? So not just your total testosterone number, because yes, that matters, but your free testosterone is what's actually being used in your body, okay? There is a difference. So do not be fooled when you get these tests. If you go to your normal doctors, nothing against, normal primary care physicians, nothing against anybody that's doing anything different. I just think this is a better way of doing it. We have a proven track record of helping patients, so we know what to test for. We know what to look for. Our doctors are extremely skilled. Like I said, WorldLink Medical, A4M, the doctor, our medical director, Dr. Joe Clark, he's got 20 plus years as an ER doctor. And this guy studied hormones with me, with WorldLink Medical, over in Salt Lake City under Dr. Neil Rouzier. I'm dropping some names on you that may not mean anything, but Dr. Neil Rouzier, we're talking one of the best hormone experts in the country and in the world. And then you have Dr. Terry Hertog, who I was with in Dubai. I'm going to go see him again in Dubai, hopefully this fall. Let's pray these restrictions, these flight restrictions kind of go away, okay? So let's move into getting blood work regularly. Now, if you are on a testosterone therapy package, okay, or if you're on a thyroid therapy, or if you're on estradiol, progesterone therapy, anything, if you're on any of these therapies, okay, we are dealing with hormones. These are very delicate things in the body. So we want to make sure that we are on top of whatever's going on in your body. If we aren't checking your blood levels relatively frequently, we are missing what could be happening in your body. So when you start a program off, we want to check what's going on in the first 6 to 8 weeks, okay? You get a follow-up consultation, you want to see what's going on. It's not just like, hey, how you feeling? Yeah, that's important. It's very important to see how you're feeling. But we want to see if anything negative is going on as well. We want to see if there's any negative side effects that are going on with your treatment. So, that blood work is extremely important. Now, I'm not saying you have to get blood work every 6 to 8 weeks through an entire program all throughout the year. Not the case. Realistically, when you get dialed in, and when I say dialed in, that basically means you're to a point where you are feeling good, you are having no negative side effects, you are optimal both in blood level and in what you're telling us. When you get to that point, yeah, we can stretch out labs every, 3, 4, 6 months. But you're going to be getting lab work, at least twice a year. That's just kind of standard for us. We want to make sure that what you're doing is working for you. We want to make sure that you're healthy throughout the process. And, that's where we are. We are a health-centric clinic. We're not just going to push testosterone on you. We are not just going to push hormone therapies on you. We're not going to try to sell you everything that we have under the sun. And we have a lot. We have basically every injectable vitamin you can think of, injectable aminos. We have lipo C shots, B12 shots. We have all these fat loss drugs. We have every hormone therapy you can think of, and some that you probably haven't even heard of. We have peptides that come in a facial application, BPC 157 facial cream. It's awesome. By the way, I'm using it. If you haven't noticed, thank you. We also have, BPC 157 peptides for tissue healing. Unfortunately, thymosin beta, TB500, and thymosin alpha are kind of going away now, and we can thank the wonderful 3-letter agencies in the U.S. government for messing that up for a lot of people. I can make a whole video on that alone about how those two were targeted, unfortunately, because there were some doctors out in California making a lot of money and basically misconstruing that as a cure for a certain virus. I'm not going to get into that any further. Basically, it messed that up for everybody, okay? But we have a lot of different treatments available, and these are, you know, things that we could really and relatively give to everybody. Everybody's going to benefit from them, but we're not here to sell you. We are here to make you feel and make you react and make you kind of just behave like your younger self. And when I say that, I don't mean, you know, like 5 years ago. I don't mean 10 years ago. It doesn't matter what your age is. Your younger self, meaning that time in your life when you felt amazing. Usually that's everybody in their late teens, early 20s, okay? Where you pretty much felt invincible, and you're, you know, it was hard to gain fat and it was easy to gain muscle, and you felt energetic and you had a crazy great sex drive and everything was good. You know, you had your hair, your skin looked good, whatever you have, you know, in your head when you think of, oh, wow, man, when I was 22, when I was 25, when I was 30, I felt and looked amazing. That's where I want to get you. That's where we really work at getting people, because, you know, you could be 50 years old and we can literally hormonally and physiologically make your body react like you're 25. That's not a joke, and it's not unhealthy. Okay, having an optimal hormone system, having an optimal system and hormone levels is not harmful. Okay, if it was, we would all be having issues when we were in our teens, 20s, and 30s. That's when we were optimal, when we were younger. None of us have issues. We heal faster. You know, our body doesn't store fat as easy. We gain muscle easier. Our brain works better. Our sex drive is better. We're more fertile. We're more everything. Everything's better. So we can get you from where you are now all the way to feeling like you were when you were younger. That's the best part about this. So blood work, very important. And I want you guys to make sure that you keep on top of it, whether you're on a therapy program or not. And listen, you can get blood work from your doctor, okay? Don't get it wrong. You don't have to come to me to get your blood work. You can go and ask your doctor to get blood work. Will they test what you want to test? Not all the time. Will your insurance cover it? Not all the time, because these are very specific tests. What we do is we have a volume discount through LabCorp, okay? And LabCorp is the largest nationwide lab company. You can basically find their LabCorp locations anywhere in the country, all right? So you go to any LabCorp near you, you get that blood drawn, we get the results, and it's $150. It's usually cheaper than people's insurance deductibles. So, you know, it's worth it to just see a picture of what's going on inside your body, all right? Let's move into vitamin levels, specifically vitamin D, okay? Vitamin D, every single person on here that I see watching, I see you all watching, okay? I can see your names listed up in front of me. Every single one of you, assume you are deficient in vitamin D. If you are not already supplementing a high quality vitamin D, if you are not getting an injectable vitamin D, you know, like I said, high quality oral vitamin D. If you're not doing something to supplement vitamin D, unless you work out in the sun every single day, which even then, you know, the way that we metabolize vitamin D from the sun, it doesn't work so well anymore because our diets suck. That's just the truth. I hate to tell you. If you aren't supplementing vitamin D, you are deficient. Look in the mirror, say I'm vitamin D deficient, accept it, and do something about it. Because it is probably the most important thing you will do for your health, your immunity, and your hormones. If you guys did not know this, vitamin D is not actually a vitamin. Vitamin D is misclassified as a vitamin. It's actually a hormone. Vitamin D acts like a hormone in your body. It is actually a hormone in your body, okay? I know it sounds counterintuitive. I know it sounds weird. You guys can research it. Look it up yourselves. Go on Google. Don't trust me. I'm not a doctor. I'm just a clinic owner. So go on there and look it up. Vitamin D, very low in most of the population. Now I say most, I'm talking like 85, 90% of the population. I don't know that number, don't quote me on it, but you guys need to be supplementing it. Immune system, okay, extremely dependent on vitamin D. Yes, vitamin C is always the one that's being talked about for immunity. Yes, it's very important. Like every other vitamin, mineral, trace mineral, anything you can think of, okay? Anything you can think of, vitamin D is playing a very important role. All right, they even have some speculation, there's some science behind it. I'm not going to get into the science or the research behind it because I'm sure my video will get kicked off of Facebook, Instagram, YouTube, who knows? But vitamin D is very efficient in helping to fight and helping to prevent things like cytokine storms from viruses, okay? So, you know, whether it's the flu or whether it's any other kind of virus, vitamin D is extremely important. So get on it. And yes, we test vitamin D in our blood work. All you have to do is just ask for it, okay? So guys, let's just wrap up here very quickly, and I will take some questions because I am on Facebook Live. I see you guys still watching. Any questions you guys have on hormone health, please ask right now. I will gladly answer anything that you have. Even if you want to join me on a live video, you can pop yourself right there. I think there's a little button, and you guys can even join me live on here and ask your questions live. But we are talking about HRT here. We're talking about hormone therapies, hormone replacement therapies. We are talking about hormone health. We are not talking about bodybuilding. We are not talking about steroid abuse. We are not talking about drug abuse. We are talking about hormones and why they are healthy and what they do for you, okay? Now, guys, I don't want you to get all freaked out about hormones and think that they are anything negative that's going on in your body. You are naturally going to decline in your hormones. It's natural. You can't avoid it. It's impossible to stop. So as you decline, okay, as you decline on the hormone level, your testosterone, your ladies, estradiol especially, progesterone, we're talking pre, peri, postmenopausal women. When you start declining in those hormones, we're talking about women right now, you're going to start feeling different, and there's a reason. You're going to start gaining weight. You're going to feel like crap. You're going to get the night sweats. You're going to be bloated. You're going to be irritable. Those are all hormone related. Your brain stops working. Anybody experiencing that right now? I can guarantee you that if you are experiencing that major brain fog, you are probably hormone deficient in one thing or another. I saw a question on vitamin D. I think it related to how much do I recommend daily dosage if you are overweight. I see Ron Gallup on here, who is an IFBB pro, and he actually does come to the clinic. He wouldn't mind me saying that. He's saying 5,000 IU or 10,000 IU daily. All right, so he's not incorrect. It is going to be dependent on who you are, what your body fat level is, how much you weigh, and where your vitamin D is. Can you do too much vitamin D? Kind of. Yes, you can. And you can do too much of anything. All right, let's be honest. You can drink too much water. You can die from too much water. Somebody did that actually. I don't remember who it was. Yeah, so vitamin D, you can almost not get too much, but it is possible. Now, vitamin D is fat soluble, okay? So the more fat that you have in your body, the more vitamin D you need to take. Now, what fat soluble means is that all of that vitamin D is going to start saturating your fat cells first. So if you have a higher level of fat, if you have a high percentage of fat, you are needing to saturate those fat cells first before you start seeing the benefits of that, basically that steady stream of vitamin D in your blood. A way to circumvent this, and I don't think I have a vitamin D behind me. I don't. Way to circumvent this if you're taking oral vitamin D is take injectable vitamin D. Injectable vitamin D, what it will do is it will super saturate your system very quickly. So you can take I don't even remember what the injectable vitamin D IU is, but it's maybe like 5,000 IU, let's say. Let's say it's 2,000 IU, whatever it is. You're getting injectable, number one. So you're going to get an extremely high absorption rate. It's an intermuscular injection. You can even do vitamin D's in IV. Okay, we actually have a testosterone, believe it or not, with vitamin D mixed in it. It's amazing. It's one of my favorite testosterone blends that we have. So, the more fat you have, the more fat in your body, the more vitamin D you're going to need to saturate those fat cells to get your vitamin D levels to the level where you're optimal, okay? And now we're talking optimal level. We're not talking about going crazy, okay? If you guys look at your blood tests, so I don't even have a blood test in front of me, but let's say that testosterone level, let's say it's between 200 and 900, okay? That's the reference range that they do there. Does that mean that you are optimal at 200 and 900? No, it doesn't. You are probably most likely optimal between 700 and 1500. Does that sound high? Sure. Do I know what your baseline is? No chance. Neither does the blood test, okay? When I was younger, I had a testosterone level, a total testosterone level in the 1500s. That was natural. If I went to any doctor and showed them that, they would have said 100% this guy is on testosterone. He is taking exogenous testosterone. I wasn't. So that could be the same thing with you guys, all right? If you are coming into a clinic and they are just basically giving you a cookie cutter dose, here's 100 milligrams a week, here's 200 milligrams a week, or God forbid they do something crazy like give you 100 or 200 milligrams every 2 or 3 weeks. If a doctor does that, run, okay? That's not how it's supposed to be administered. So if a doctor is giving you a shot of testosterone every 2 or 3 weeks, run out of that office and go find a clinic or a doctor that will give you the right kind of treatment, because that is the wrong kind of treatment. I have no problem saying it out here. Any doctor that wants to argue with me on that type of treatment, you are more than welcome to try to argue with me, and I will show you lab after lab and proof after proof that you are wrong on that type of therapy and treatment. It just doesn't work. Okay? So you need to go in and you're going to start low. If you come into here, we're going to start you low. We're going to titrate to effect. Okay? What that means is we are going to increase your level slowly. So let's say you start at 100 milligrams a week. We usually split those doses, by the way. There's a reason for that. Let's say you start at 100 milligrams a week. We are going to increase. We're not going to worry about the labs so much, okay? We're going to look at the numbers, of course, but we're going to increase until we get to that happy point where you feel really, really good, where you feel really optimal, and you're not having any side effects. So we're going to get all the positives with none of the negatives. Now, if I started you off at 200 or 300, or I've seen crazy clinics doing 400 milligram doses, it's insanity, but I've seen them do it. If you have a clinic doing that, they're overdosing you. They are not giving you anything that is healthy for you. 400 milligrams a week of testosterone is very, very high, and you're going to have a very, very high testosterone level, and you're going to have a lot of issues. You're going to have estrogen issues. You're probably going to have some blood pressure issues. You're probably going to have some hematocrit and hemoglobin issues. That's your blood getting too thick. So, we're going to be the most transparent with you. We're going to be very health centric. Okay, and there are clinics like us all over the place. You don't have to come to Aspire Rejuvenation. All right, that's bad for business for me if you go somewhere else. But all I care about is you getting healthy, you getting the correct treatment. That's what makes me happy. Okay, so guys, blood work, get it done. Get it done and just check. All right, hormone health. There are a lot of hormones in your body. Look at getting everything checked. Testosterone. Okay, men and women. Testosterone, estradiol, progesterone, check your TSH, the rest of your thyroid hormones, T3, T4. Don't worry about reverse T3, reverse T4. They're very expensive, not needed for an initial panel. Okay, check your vitamin D levels. If you guys are interested in your growth hormone levels, check your IGF-1. IGF-1, insulin-like growth factor. Growth hormone, okay? Growth hormone goes to the liver, and the liver basically will turn that into and secrete IGF-1, all right? IGF-1 is a growth factor. I think there are 6 or 7 growth factors that come from growth hormone, but they're basically all metabolized in the liver. So when you want to check your growth hormone levels, what you're going to check in the blood is the IGF-1. I have a question on here. So if I'm on HCG test and an estrogen blocker, is that going to affect fertility? Testosterone therapy will always affect fertility, okay? And the reason for that is because what you're doing is you are introducing an exogenous testosterone in your body. Your body is a well-oiled machine, so it will automatically say, oh, I have an influx of testosterone. I no longer need these testicles to produce testosterone. So what that can do is that can start to shut down your testosterone production and your testicular function. Since you are an HCG, it's a perfect segue because HCG actually kind of stops that from happening. Does it stop at 100%? No. Does it stop at 70%? Maybe. 80, 90, 50%? Maybe. Yeah. And you're going to notice it's dependent on your HCG dose, okay? So testosterone will affect fertility. There's no doubt about it. HCG will keep your testicular function going, which means you're going to have a natural production of testosterone. You're going to continue to produce sperm. I'm like doing this, sorry. You're going to continue to produce sperm. You're going to continue to make a natural testosterone level. and you're going to maintain some level of fertility. Is it going to be enough to maintain that maximum level of fertility to impregnate somebody? Maybe. Testosterone is not a contraceptive. Okay, don't mistake it for that. Gentlemen that are watching this, do not mistake your testosterone therapy for a contraceptive. It doesn't work like that. It does not mean you are infertile. There are plenty of men out there who have thought, oh, I'm on testosterone, my testicles are no longer working, I'm good to go. Not the case, guys. Not everybody shuts down completely from testosterone therapy, and it does take a while for that to happen. So, if you're not trying to have kids, be careful. That's all I have to say. But yes, your Hcg dosage, it will be dependent. So, I don't know what your dosage is. A lot of clinics, including ours, are doing things like 250 IU twice a week. Some people need more. Some people are okay with that dosage. It does keep a level of activity down in the testicles. But some people need more. I am somebody who needs like 750 IU twice a week. So we're talking, 2-3 times more than what you're taking most likely. Again, I don't know your dose. You're more than welcome to, send me a message and we can go over it. If you guys are looking for advice, 20 units, I'm not sure what that means. It depends what your mixture is, okay? So I don't know what your mixture is. I don't know what your HCG vial, how many IUs are in that HCG vial. If you guys are looking for advice, okay, on testosterone therapy, men, and I believe women are in there too, TRT advice, testosterone replacement therapy advice. It's a group on Facebook right on here. You guys can search it. I'm a member. A guy named Mark is the moderator and creator. It is an absolutely excellent group. There is information from people all over the world, definitely people all over the country. We have a lot of patients in there. I'm always in there answering questions. So, go on there. You guys can ask your questions. You will get a crazy amount of information. A lot of great doctors, a lot of great clinics in there, a lot of great practitioners, and yours truly in there. So if you guys have any questions on there for TRT, feel free to go on there, okay? All right, guys, I'm going to wrap this up. I want you guys to take control of your health, okay? I want you guys to take control of your health span. Health span meaning the amount of time you are alive that you are healthy, not lifespan, okay? Your lifespan, if you live 100 years, if the last 30 of it suck because you're unhealthy, that's not life. What we want to do is we want to increase that health span. I want you to be healthy, healthy, healthy all the way up until that last minute you're alive, if I can help it. That's my goal. I want to make you feel younger. I want to make you feel healthy. That's all I care about. If you guys need to contact me, I am on here on Facebook. You guys can look me up on YouTube, Tomo Marjanovic. You guys can look me up on Instagram, Tomo Marjanovic. You guys can look up Aspire Rejuvenation, the website. I will link it below, aspirerejuvenation.com, aspiresups.com for the supplements. We got some back here. Vitamin D is on there, okay? It's called K2D3. K2, extremely important when you're taking vitamin D. It helps it shuttle to the places it's supposed to go, okay? And I have all my vitamins actually right in front of me. And yes, I do take this huge handful of vitamins every day, but that is why I'm extremely healthy. That is why I maintain my youthful appearance. Can you guys believe I'm 78 years old? I know, I look freaking awesome. I love you guys. Thank you for watching. I appreciate all of you. Thank you so much. Give me a like, give me a follow, share this video if you got something from it. If you guys have any more questions, comment below, and have a great day.